na kupata nafasi na baraka ya kushirikiana na hospitali hii kufungua majengo yenu mapya. Nataka niseme kwa niaba ya serikali ya Kenya, pongezi na asante sana kwa kuwa washirika wetu katika mambo ya matibabu ya Wakenya. We don't take it for granted that church facilities are partners and they support the government of Kenya in ensuring that health services are provided to communities, all strata of communities. Sister Faith has said that this hospital serves people in the middle and lower social strata of our country. And I want to say on behalf of the government of Kenya that we recognize, we appreciate, and we value the partnership between the state and the church, and especially on matters to do with education and health provision. I want to say, sister, and your team, and to the entire Catholic Church, thank you very much for supporting us in ensuring that Kenyans access health facilities at every level. Nimesema asante sana. We don't take it for granted that you are our solid partners in this area. I want to say just two things. Sister Faith, has said that you have so many facilities and so many plans, including a modern hospital. And we know what improving social and especially health services do to society. We identified as the government of Kenya the provision of health as a major component of what we need to do at this point in time. That is why universal health coverage is one of the four pillars of our Big Four plan. And that being the case, we have done trials on the best way possible on how we can work with health facilities, public health facilities, private health facilities, church-sponsored health facilities, on making sure that we rally and bring all the infrastructure that is available and all facilities that are available in providing that much needed universal health to the citizens of our country. We are aware of the challenges that our health facilities are going, and that is why on identifying universal health or provision of health as a major component of what the government of Kenya wants to do, we've done, as I have said, trials. We've done a pilot scheme on how best to go about it. We've gotten some lessons, and we are going to work towards ensuring that there is a predictable mechanism of ensuring that people can afford to pay for health facilities. And going forward, we are looking at the financing so that a hospital like this is not burdened with huge bills of people who cannot afford. There must be a way where we can get everybody to pay their bills in a predictable and affordable manner. That's why we are talking about universal health. You all know that today the lowest category pay 500 shillings for NHIF per month, and the highest is 1,700. There is a problem there because the people who pay 500 are the small hustlers in town. The mama mbogas, the boda guys, all these small traders and people who are at the lower strata, and they pay 500 shillings. Most of these people, their income per month is like 5,000. So they are actually paying 10% or 5,000 per month for health services. Myself and these big people here who earn something like 1 million shillings, we pay 1,700. There is a problem because the poor are paying more than the rich. So we need to reorganize that structure so that if a hustler is paying 10% of their income, I should also pay 10%, which means I should not be paying 1,700, I should actually be paying 100,000 because that's 10% of my salary. And we need to reconfigure, and if everybody paid the same amount as per their percentage, we will collect enough money in NHIF that we can use to make sure that a hospital like St. Anne Mission Hospital does not have huge pending bills because people cannot afford. And that is the way to the future. And that way, the facility Sister Faith was talking about here would easily be built, because if you collect all the money that you use for treatment, it should be possible to ensure that you can increase the facilities. So going forward, we are going to go to Parliament and ask Parliament to make it even so that everybody pays the same and we all help one another to carry the weight of provision of health services in our country. And we want to ensure that NHIF is a percentage of everybody's income so that everybody carries the same weight. Those who earn more pay more, and we can even begin to think of how to reduce for the lower category. Instead of paying 500, we can then negotiate and see what is it that they can pay that is affordable. So going into the future, I needed to say that so that you understand that our universal health coverage program, through the trial and the pilot scheme, we've learned lessons and we are reconfiguring so that we can deploy a much more enhanced and a clearer mechanism and program that will carry everybody. And I agree with what you have said here, that we should find a way of supporting the people at the lower side of the pyramid so that we can all move together as citizens of one country. So with those many remarks, I am equally very happy to come to St. Anne Mission Hospital. I have heard about it. Nimetembea huku barabarani siku nyingi, lakini sijapata nafasi ya kuja hapa. Lakini leo Mungu amenipatia nafasi hiyo, nikuje hapa, niungane na nyinyi, na nimeona ile bidii mumeweka hapa, sio bidii ndogo. Na nikiona ma sisters hawa ndio wanasimamia hii mambo makubwa hapa, I am persuaded more that what men can do, maybe women can do better. So again, let me say thank you very much, Sister Josephine and your team, for what you're doing here. We appreciate. We may not say it loud enough, but I want to tell you, the government of Kenya recognizes what you're doing. We appreciate your partnership, and we value the service that you give to the people of this region. And I promise that we will find the mechanism to work together so that we can support you and ensure that you continue to do the good that you're already doing. So asanteni sana, na kwa sababu niko na shughuli mrefu, nataka niwachie hapo nikisema asante tena, na mara hiyo ingine nitakuja hapa tukifanya ile kazi kubwa mnasema mnataka tufanye hapa ya kujenga hospitali. You can count me as one of your partners in that endeavor. So asante sana. Najua ya kwamba unajua mimi